So today marks the start of National Youth Violence Prevention Week, and the goal is to educate students, school staff, and the community on ways to effectively reduce youth violence and open up the conversation. So I'm joined right now by Heather Hagen, Executive Clinical Director of Outpatient Services for Newport Healthcare, to talk more about this. Thank you so much for joining me. This is an extremely important topic, and I think one that a lot of people are kind of confused on how to go about, especially with parents. So let's first start off with how delicate the topic is, and maybe some do's and don'ts for parents when it comes to approaching their children when it comes to violence.
Yeah, I think probably the basic tenet, the most important thing, is to build a foundation with your child of trust and communication, so that if they are experiencing something along these lines, that they will feel safe enough to come to you as a parent and share their concerns.
Is there a limit? Let's just say as a parent, you know something is happening, but you know your child is having a difficult time talking about it. How do you tiptoe around that to make sure they either know they're safe in letting you know what's going on, or getting them to feel comfortable to open up?
Yeah, again, it's all about that safe place for your child, and so to be able to give them that opportunity to open up to you or to anyone, another safe adult, whether that's a school counselor or a teacher or a coach or a therapist, to be able to have someone that they can reach out to and say, hey, listen, I'm not sure how I want to deal with this yet, but I need to talk to somebody about it.
So when we see violence happening in schools, whether it be school shootings we've seen, bullying or other type of fights or violence, what are some of the conversations you have or that you hear? I know you work with young adults and teens on this. So what does that conversation look like?
Yeah, it's really about educating them of, what's appropriate, what's not, if they are being bullied, to really give them the verbiage to be able to come to a trusted adult and to say, hey, listen, I'm not feeling safe at school or in my home even. And as a parent, there are a lot of warning signs that you can look out for, which may include things like changes in their appetite, their sleep habits, if they're withdrawing, if they are sort of not engaging in the normal activities that they love. There are lots of things that a parent can sort of trust your gut on and say, hey, listen, I'm sensing that maybe something is off. Can we talk? Is everything okay at school? How are things with your friends? And if you have that trust already built as a parent, right, then you can more than likely have your child, at least share a little bit with you and say, hey, listen, there are things that are going on. I'm not quite sure how to handle them, and I don't want you to do anything yet, But as a parent, to be able to reach out to a school, for support. Reach out to a therapist, a mental health professional, and say, hey, listen, I need some support in this.
It's such a terrifying situation for a lot of families, but it's something that we all deal with nowadays. Thank you so much for joining me. We already ran out of time, but really appreciate it. And we are going to have all of this information on our website. You can just go to kcalnews.com, click on Seen on TV for more of this.